I want you to think back to the last time you woke up and just felt off. Not sick, not in pain, just quietly aware that something about your body wasn't responding the way it used to. If you're over 60, there's a good chance you know exactly what I'm talking about, and there's a good chance it's connected to something you've never said out loud to anyone, not even your doctor. Here's what I've learned after spending years sitting across from men exactly like you. That quiet, private frustration almost never comes from nowhere. It comes from real measurable changes happening in your blood vessels and your nervous system changes that have very specific, very fixable causes. Hi, I'm Dr. Emily Carter. I've been practicing urology for over a decade now, and if you've watched any of my other videos, you know I don't do vague wellness advice or recycled internet tips. Everything I bring you comes from what I actually see and treat in my clinic week after week with real patients who walk in feeling exactly like you might be feeling right now. Today, I want to talk about something specific: the anatomy behind morning erections, why that response quietly fades for so many men after 60, and 3 real physiologically grounded areas of the body where supporting healthy circulation and nerve function can genuinely help restore that response over time. This isn't a gimmick, and I'm not going to promise you overnight miracles, but I'm going to give you real science, explained simply the same way I'd explain it to a patient sitting in my office. If you've ever quietly wondered about this and never had anyone give you a straight answer, stay with me. And if you want more of these honest, no-nonsense conversations, hit subscribe now and turn on notifications, because I post new videos like this every week, and I don't want you missing them. Let's get into it. Before we get to the 3 specific areas I want to walk you through, I need you to understand something, because it completely changes how you think about this issue. What's happening isn't really about aging in some vague, unavoidable sense. It's about 2 very specific, very identifiable physiological processes slowing down together. The first is circulation. Over decades, the walls of your arteries can gradually lose elasticity, a process doctors call endothelial dysfunction. It's often quietly accelerated by things like mild chronic inflammation, elevated blood pressure, or simply years of reduced physical activity. When this happens, your blood vessels can't dilate or open wide as quickly or as fully as they once did. And a firm, reliable erection, whether during intimacy or automatically while you sleep, depends entirely on blood vessels being able to open rapidly and let blood rush into the erectile tissue. The second process is nerve conduction slowing down. The nerve signals responsible for triggering that entire vascular response, the ones that essentially tell your blood vessels it's time, transmit more slowly and less powerfully as we age. It's the same reason reflexes generally slow with age throughout the body. This isn't unique to this one area. It's a broader pattern, but it becomes especially noticeable here because the response required is so immediate and so dependent on precise timing between nerve signal and vascular response. Put those 2 changes together, slower wiring and stiffer plumbing, and you get exactly what so many men over 60 experience: a morning erection response that used to happen automatically and now happens rarely or not at all. I want to be really clear about something important here. This is not simply part of getting old in some fixed, unchangeable sense. It's a physiological pattern, and physiological patterns respond to intervention. I think it's worth pausing here to explain why I and urologists generally pay so much attention to this specific symptom, because it's not really about the moment itself, it's about what that moment tells us. Morning erections happen automatically during REM sleep, largely disconnected from conscious arousal or any sexual thought at all. Because they're automatic. They function almost like a built-in diagnostic test your body runs every single night, quietly reporting back on whether your vascular system and nervous system are working the way they should. When a patient tells me morning erections have become rare or disappeared, that tells me something meaningful is likely happening with blood flow, nerve signaling, or hormone levels. And it prompts me to look closer at cardiovascular health specifically, since the blood vessels involved here are small and sensitive, often showing signs of trouble before larger vessels elsewhere in the body do. This is actually one of the reasons I take this topic so seriously in my practice. It's rarely just about this one symptom in isolation. It's often an early window into your broader cardiovascular health. Now, here's where I want to introduce something a lot of men have never been taught. There are specific regions of the body tied directly to the blood vessels and nerve pathways involved in this entire process, where supporting circulation and reducing chronic tension can genuinely help this system function better over time. I want to be upfront about the philosophy here because it matters. This isn't about forcing a response or chasing some dramatic immediate fix. It's about supporting the underlying vascular and neurological machinery so that your body's own natural process has the best possible conditions to work the way it's designed to. Think of it less like flipping a switch and more like clearing debris out of a pipe so water can flow the way it's supposed to. Again, let's walk through the 3 areas. The first area is the perineum. the region between the base of the scrotum and the anus. I know this might not be an area you've thought about much, but anatomically, it's directly involved in this entire process. The perineum sits right above the bulbocavernosus muscle, part of your pelvic floor. This muscle plays a genuinely mechanical role in erectile function. Once blood flows into the erectile tissue, this muscle is largely responsible for contracting and essentially trapping that blood inside, which is what creates and maintains firmness. If this muscle is weak, which becomes increasingly common with age and with a sedentary lifestyle, blood can flow in but doesn't stay trapped as effectively, leading to erections that may start but don't sustain, something doctors sometimes refer to informally as a venous leak pattern. This is exactly why pelvic floor exercises, which most men have genuinely never been taught, have real clinical research behind them for supporting erectile function, particularly in men whose difficulty is mild to moderate and tied to muscular or vascular causes rather than more significant underlying disease. Simple, consistent pelvic floor engagement, similar to what's sometimes called a Kegel exercise, but specifically taught for men rather than borrowed from postpartum recovery programs, strengthens exactly this mechanism over time. Beyond exercise, gentle attention to this region, through general relaxation practices, reducing prolonged sitting, and simply not ignoring chronic tension that builds up here, supports both the muscular strength and blood flow this area depends on. The second area is the inner thigh, specifically along the path of the femoral artery, one of the major blood vessels responsible for supplying blood to the entire pelvic and genital region. I bring this up because I want you to really internalize something. Erectile function is at its core a circulation issue. Anything that affects blood flow through this pathway, whether that's arterial stiffness, plaque buildup from years of elevated cholesterol, or simply reduced circulation from sitting most of the day, directly affects how well this entire system functions, including that automatic nighttime response we've been discussing. This is precisely why I talk so much on this channel about cardiovascular health, movement, and reducing prolonged sitting, because these aren't separate topics from what we're discussing today. They're directly connected. Regular movement, stretching, and mobility work focused on the hips and inner thighs support healthy circulation through exactly this pathway. I often specifically recommend this to patients who have desk jobs or spend long stretches of the day seated because prolonged sitting measurably restricts blood flow through this exact region, compounding whatever other cardiovascular risk factors might already be present. None of this replaces addressing your broader cardiovascular health directly through diet, exercise, and managing blood pressure and cholesterol with your doctor. But it's a legitimate complementary piece of the picture, supporting the same vascular pathway from a different, very practical angle. The third area is the lower abdomen, specifically the region just above the pubic bone. This area sits close to the nerve pathways and blood vessels that travel from the pelvis toward the erectile tissue, and it's an area I find most men have simply never considered relevant to this conversation at all. Maintaining core strength and flexibility in this region supports the overall muscular and vascular environment surrounding this entire pathway. This area also tends to be where a lot of men unconsciously hold physical tension, particularly men managing chronic stress or sitting for long periods, and that chronic tension can subtly interfere with healthy nerve signaling through the region. I want to pause here because this connects to something I think about constantly in how I approach men's health overall. This isn't about a single trick or shortcut. It's about understanding that your body is one interconnected system: circulation, nerve function, hormones, muscular support, stress, sleep, all of it working together rather than as separate, isolated problems. That's exactly the philosophy behind a complete resource I put together called the Iron Age. It walks through testosterone, sleep, strength training, nutrition, stress, prostate health, and yes, the full physiology of erectile function, giving you a clear, practical, step-by-step protocol for supporting each piece of the picture rather than chasing isolated fixes. For $49.99, that's genuinely less than a single specialist visit, and it's something you can reference for years as your body continues to change. If these videos have brought you real value, I'd encourage you to take a look. I'll leave the link below. Now let's bring this back together. I always want to be honest with you, even when it's not the most exciting thing to say. These three areas, the perineum and pelvic floor, the inner thigh and femoral pathway, and the lower abdomen and core, all have real, legitimate anatomical connections to erectile function. Supporting circulation, reducing chronic tension, and strengthening the relevant muscles in these areas has genuine research behind it, particularly for men experiencing mild to moderate age-related changes, but I need to be equally clear about what this doesn't replace. If you've noticed a significant persistent change in morning erections, that deserves an actual conversation with your doctor, not just a self-directed routine at home. Cardiovascular disease, diabetes, low testosterone, and certain medications are all common, legitimate underlying causes that require direct medical evaluation and often specific treatment. Basic blood work checking your testosterone levels and blood sugar, along with a broader cardiovascular assessment, is a reasonable, important first step, especially given how closely tied this symptom is to heart health more broadly. Think of what I've walked you through today as a genuinely useful, low-risk, complementary practice, one worth incorporating into a broader approach to your health, not a replacement for identifying and addressing whatever underlying cause might actually be driving a significant change. Practically speaking, here's what I recommend to my own patients: a few minutes daily of pelvic floor engagement, general mobility and stretching work focused on the hips and inner thighs, and consciously reducing how much of your day is spent sitting without a break. None of this needs to be complicated or time-consuming. Consistency matters far more than intensity here, because we're talking about supporting circulation and muscular tone gradually over weeks and months, not producing some kind of instant, dramatic effect. I want to set realistic expectations with you the same way I would with any patient in my office. Many of my patients who've built this kind of consistent attention into their routine, alongside genuinely addressing their broader cardiovascular health through diet, exercise, and working with their doctor on any underlying conditions, report noticing more consistent morning erections within a few months. Not overnight, not from a single session, but through consistent patient attention to the systems that actually drive this response. I want to close with something a little more personal. I've had this conversation in one form or another with more men than I can count over the years, and almost every single time, there's a moment where I can see real relief on their face, not because I've told them something magical, but because I've finally given them a straightforward, honest explanation for something they'd been quietly worrying about alone, sometimes for years. You're not broken. Your body isn't failing you out of nowhere. What's happening has real, identifiable physiological causes and real evidence-based ways to address it. That's the entire reason I make videos like this one, because too many men spend far too long assuming this is simply something to quietly accept, when in reality, it's something you can genuinely understand and actively work on. I want to go a little deeper on the pelvic floor specifically because in 12 years of practice, I've found this is genuinely the most overlooked, underutilized tool available to men dealing with this issue, and almost none of my patients had ever heard of it before walking into my office. Most men associate pelvic floor exercises exclusively with women, typically in the context of postpartum recovery, and simply never consider that they have the exact same muscle group, playing an equally important, if different, functional role. The bulbocavernosus and surrounding pelvic floor muscles in men aren't some vestigial afterthought. They're actively involved every single time blood is meant to stay trapped within erectile tissue, whether during intimacy or during that automatic nighttime process we've spent this whole video discussing. Here's what I find remarkable clinically. Unlike a lot of interventions in medicine which require expensive equipment, prescriptions, or procedures, this is genuinely something you can begin training today for free, in under 2 minutes a day. And the research supporting it, particularly for men with mild to moderate age-related changes rather than more significant underlying disease, is honestly more robust than most men would expect for something this simple. I think part of why so few men train this area is simply that nobody ever explained how to actually locate and engage it correctly. So let me walk you through this the way I would with a patient in my office. The simplest way to identify the correct muscle is to imagine you're trying to stop the flow of urine midstream, or trying to prevent yourself from passing gas. The muscular contraction you feel in both of those scenarios involves this same muscle group. I don't recommend actually practicing by stopping urine flow regularly, since that can interfere with normal bladder function over time, but it's a useful one-time reference point to help you identify exactly which muscles you're meant to be engaging. Once you've identified the sensation, the actual exercise is straightforward. Contract that muscle group, hold for a few seconds, then release completely and rest for the same duration. A reasonable starting routine involves 10 to 15 repetitions, once or twice daily. What matters most clinically is consistency over time rather than intensity in any single session. This is a slow training process similar to building strength anywhere else in the body, and meaningful improvement in muscular tone and function typically develops over a period of several weeks to a few months of regular practice, not overnight. I want to mention something important here too. Some men, particularly those dealing with chronic pelvic tension or certain pelvic pain conditions, can actually benefit more from learning to relax this muscle group rather than simply strengthening it, since chronic overtightness can also interfere with healthy function. This is exactly the kind of nuance that's worth discussing directly with your doctor or a pelvic floor specialist if you're uncertain which approach applies to your specific situation, rather than assuming more contraction is always better. I also want to zoom out for a moment because I don't want the specific anatomical areas we've discussed today to overshadow the bigger picture they're actually part of. All three of these regions ultimately depend on the same underlying resource: healthy, efficient blood flow throughout your entire cardiovascular system. This is precisely why general cardiovascular fitness, regular aerobic activity, whether that's brisk walking, cycling, or swimming, has consistently shown some of the strongest research support of any intervention for supporting erectile function broadly, including this automatic nighttime response. Regular aerobic activity improves the elasticity and responsiveness of blood vessels throughout the body, directly addressing that endothelial dysfunction I mentioned earlier in this video, the stiffening of arterial walls that develops gradually over decades. I often tell my patients that the 3 specific areas we've walked through today work best as a targeted complementary layer on top of this broader cardiovascular foundation, not as a replacement for it. A man who's sedentary, carrying excess weight, and managing elevated blood pressure or cholesterol without addressing any of that directly is unlikely to see meaningful, lasting improvement from targeted regional attention alone, no matter how consistently he practices it. But a man who's actively working on his general cardiovascular health and layers in the specific targeted attention we've discussed today tends to see considerably more complete, satisfying results. I'd be doing you a disservice if I didn't also mention 2 other factors that directly affect everything we've discussed today, because I see them overlooked constantly in my practice: chronic stress and poor sleep. Chronic stress keeps your body in an elevated state of sympathetic nervous system activation, essentially a persistent low-grade fight-or-flight response, which directly works against the relaxed vascular state needed for healthy erectile function, including during sleep. Elevated cortisol from chronic stress also has documented negative effects on testosterone levels over time, compounding the issue from a hormonal angle as well. Sleep quality matters just as directly, since the automatic nighttime erections we've been discussing throughout this video occur specifically during REM sleep. Men with poor sleep quality, frequent waking, or conditions like sleep apnea, which becomes increasingly common with age, often experience measurably reduced nocturnal erectile activity simply because they're spending less time in the sleep stage where this process naturally occurs. This is actually one of the more commonly missed underlying factors I see clinically. Patients come in concerned specifically about this symptom, and it eventually traces back to undiagnosed sleep apnea, something that, once properly treated, often improves this exact issue as a secondary benefit alongside the more obvious improvements in energy and overall health. If you snore heavily, wake up frequently through the night, or regularly feel unrested despite spending adequate time in bed, that's genuinely worth raising with your doctor as part of this broader conversation, since addressing it can meaningfully improve multiple areas of your health simultaneously, this one included. I think the most honest way to summarize everything we've covered today is this: there is no single trick, pressure point, or exercise that operates independently of your overall health. The 3 areas we've discussed, the pelvic floor, the femoral pathway through the inner thigh, and the lower abdomen and core, all genuinely matter, and gentle, consistent attention to each of them is a legitimate, evidence-informed practice worth building into your routine. But they work best, and most realistically, as one layer within a broader approach that includes general cardiovascular fitness, quality sleep, stress management, and addressing any underlying medical conditions directly with your doctor. Men who approach this as an isolated quick fix, expecting a specific technique alone to reverse years of accumulated vascular and hormonal changes, tend to be disappointed. Men who understand this as one meaningful piece within a broader, patient-consistent approach to their overall health tend to see the kind of genuine, lasting improvement that actually matters. One last thing I want to leave you with, because I think it makes a genuine difference in whether men actually stick with this kind of routine long enough to see results. Keep it simple, but keep some kind of loose record. You don't need anything elaborate. A basic note on your phone works fine. Just jot down, once a week or so, whether you've noticed any change in morning erection frequency or firmness, how consistent you've been with the pelvic floor exercises and mobility work, and any relevant changes in your sleep quality or activity levels. This isn't about becoming obsessive or anxious over daily fluctuations, which are completely normal and expected. It's about being able to look back after 6 or 8 weeks and honestly assess whether the trend is moving in the right direction, rather than relying on vague impressions that are easy to lose track of. I've found that patients who track even loosely tend to stay consistent for longer, simply because they can see gradual progress that would otherwise be easy to miss day to day. And if after 2 to 3 months of genuine, consistent effort, you're not noticing any meaningful change, that's actually useful information too. It's a signal that something more significant may be at play, hormonal, cardiovascular, or otherwise. And it's a good, clear reason to bring a specific, documented pattern to your doctor rather than a vague sense that something feels off. That kind of specific, tracked information makes for a far more productive conversation with your doctor than simply saying things have felt different lately. It helps them narrow down what's actually worth investigating first rather than starting from scratch. So here's what I want you to walk away with today. Morning erections are a genuinely useful signal of your vascular, neurological, and hormonal health, not something to simply write off as an unavoidable part of getting older. The perineum and pelvic floor, the inner thigh and femoral pathway, and the lower abdomen and core all play real anatomically grounded roles in supporting the blood flow and nerve function this entire process depends on. Gentle, consistent attention to these areas, alongside addressing your broader cardiovascular and hormonal health directly with your doctor, is a legitimate, low-risk practice worth building into your routine. And if you've noticed a significant, persistent change, please don't just quietly work around it. Bring it up with your doctor. It might be one of the earliest, most useful signals you have for catching a bigger issue early while it's still very manageable. If this video gave you something useful or finally explained something you'd wondered about for a long time, let me know in the comments. I read every single one. And if you want more honest, research-backed conversations like this, hit subscribe so you don't miss the next one. I'll see you there.